jump theme then, you mean? I mean, my initial response, and again, if anyone needs to shoot off it at 8, please do, and we'll just continue for a few minutes. My initial response would be again, if we get our skills stronger, it won't do that, it won't be, or it won't, that won't feel like such a problem, because you'll know, okay, I know this, I know what it's doing, I'm ready, I can use my skills, I know what to do. And you can even get to a place where it's fun, it's fun watching your mind do this stuff, and then you want to challenge it, and you want to experience difficult emotions, and you want to get outside your comfort zone. And because you see the value of it, you see that will help me with everything in my life, if so. But I think we only get there through skill practice, so I guess it is unfortunate. This is where people can really hit waves of hopelessness and low mood and things like that, because you've done amazing stuff, as you described, to get out there and be doing stuff you value again, and then it jumps up in some other area. And I've had clients who have a very severe eating disorder, and they recover from the very severe eating disorder, and then OCD goes mad, and they're like, God, I've just done one of the hardest things that's possible in mental health, recovering from it, hospitalizing eating disorder, and now my mind's going on OCD. And it's painful, and it's tough, and it's really challenging. So we want a lot of compassion for that. And if we're ready to notice the pattern and to strengthen our skills and to get ready with our values-based exposure, my experience was it won't keep doing that forever. There might be a few rounds of that, but once you get really strong with this stuff, it won't do that, anymore. Like near the end of my recovery, I was experiencing existential fears. I was experiencing health anxiety, and I'd had so many other themes of OCD throughout my life, but that's where I was at, and it was jumping between them. And then I got really good on the health anxiety, and then it went massively more into the existential, and then it brought in old themes around harm and other things I'd experienced in the past. It kind of started combining stuff, and then I got a big wave of depression and some other things in there, and it was jumping around. But then once there was like a moment when I was like, I see what it's doing, like I see this pattern, and I was ready. And then it stopped doing it, when I was ready, like whatever, it can jump on anything. And that's, I work, like, not all my clients are OCD, but a good half of my caseload probably just now is OCD. And so many of them have got themes that I've had and I've struggled with, and I can talk about it and work on it, and it doesn't trigger me, doesn't set me off. Like I can work with clients with other mental health conditions that when I had health anxiety, I worried about it, like psychosis or things like that. I can do all of that. And that's just from getting the skills strong and being ready to spot the pattern, and then it won't jump around like that anymore. So it's probably just a sign to keep going with the skills, really work them, be ready to diffuse these new thoughts, look out for the new compulsions that are starting to pop up, identify, is it triggering you into different compulsions? Are they more mental compulsions now? Now that you've got better with the physical, has it gone more mental compulsions? Okay, more diffusion, more dipping in and out the stream, strengthen that skill, more connection with the present moment. And, you might find that it gets easier.